Assalamualaikum. Today we'll be talking about the various muscle attachments on the hip bone. So we'll start with the ilium, and when it comes to the ilium, it has an iliac crest, it has an anterior border, a posterior border which would be here, and then it has a lower end which forms a part of the acetabulum. So the anterior border has an anterior superior iliac spine and an anterior inferior iliac spine. On the anterior superior iliac spine, a muscle known as the Sartorius muscle is attached. Along with the Sartorius, a ligament known as the inguinal ligament is also attached on the anterior superior iliac spine. This ligament, the inguinal ligament, extends from the anterior superior iliac spine medially here to the pubic tubercle. Now on the anterior border, we have an anterior inferior iliac spine as well. On the anterior inferior iliac spine, we have the attachment or the origin of the rectus femoris muscle. Now the rectus femoris muscle is a muscle of the anterior compartment of the thigh. It has two heads, a straight head and a reflected head. So the straight head originates from the anterior inferior iliac spine, and the reflected head of the rectus femoris originates from just above and slightly posteriorly to the acetabulum. Here you can see the iliac fossa. All of this red color represents the attachment of the iliacus muscle. So here you can see this right here is the anterior superior iliac spine, and from here extends medially the inguinal ligament all the way here to the pubic tubercle, and this oblique muscle is the Sartorius muscle, which also originates from the anterior superior iliac spine. And this right here is the rectus femoris muscle, which originates from the anterior inferior iliac spine, which you can't see here. And here you can see the origin of the iliacus muscle from the iliac fossa. So this is the iliac crest, this is the anterior superior iliac spine, this is the pubic tubercle, and from the iliac fossa you have the origin of the iliacus muscle. Right, so this diagram here represents the iliac crest from a view of the iliac crest from the top, right? So we're looking down at the iliac crest. This is the anterior end and this is the posterior end. So this here is the anterior or the ventral part, and this is the posterior 1/3 part. Now if you look at this top view, you can see here is the anterior superior iliac spine and the attachment of the Sartorius as well as the Sartorius muscle as well as the inguinal ligament. Now this is the inner lip, this would be the outer lip, and the iliac tubercle here. Now all along the outer lip there is the attachment of the fascia lata. The fascia lata is the deep fascia of the thigh. Here in the anterior part of the outer lip, in front of the iliac tubercle, we have the attachment of a muscle known as the tensor fascia lata. After that, here is the insertion of the external oblique muscle in the anterior 2/3 of the iliac crest. After that, we have this one right here is the internal oblique muscle, and then here you can see the latissimus dorsi. This one right here is the transversus abdominis muscle on the inner lip, and behind that you have the quadratus lumborum muscle. So on the outer lip, we have the fascia lata throughout, the tensor fascia lata anterior to the iliac tubercle, then the external oblique and the latissimus dorsi. On the inner lip, we have the transversus abdominis and the quadratus lumborum muscle. And then in the intermediate zone, we have the internal oblique muscle. Now, this here is the dorsal part, which we talked about yesterday, that it has an outer slope or a lateral slope and a medial slope. So on the medial slope is the attachment of the erector spinae muscle, and on the outer or the lateral slope is the origin of the gluteus maximus muscle. So here you can see the iliac crest, and from the anterior part of it and the outer lip you can see the origin of the tensor fascia lata muscle, this one right here, and from the lateral slope in the dorsal segment you can see the origin of the gluteus maximus muscle here. So here as well you can see along with the iliacus muscle originating from the iliac fossa, you can also see this one right here is the quadratus lumborum muscle, which originates from the posterior part of the inner lip, and this is the transversus abdominis muscle, the one that's been cut off here, and that originates from the anterior part of the inner lip of the iliac crest. So this is a posterior view of the hip bone. So this here is the gluteal surface of the ilium. Now the gluteal surface has three gluteal lines. There is the inferior gluteal line. There is the inferior gluteal line would be somewhere here. This is the anterior gluteal line, and this would be the posterior gluteal line. Now in between these gluteal lines is the attachment of the gluteus muscles. So we have three gluteus muscles, the gluteus minimus, the gluteus medius, and the gluteus maximus muscle. So we just talked about the gluteus maximus muscle, that a part of it originates from the lateral slope on the dorsal 1/3 segment of the iliac crest. Along with that, the rest of the origin, as you can see, is from all the way from here. So it also extends posterior to the posterior gluteal line here, right? So between the anterior and the posterior gluteal lines, we have the gluteus medius muscle, and then anterior to the inferior gluteal line, this one right here would be the gluteus minimus muscle. Right, so as we talked about yesterday, this is the sacropelvic surface of the ilium. Now, this part here is the iliac tuberosity. This is the auricular surface, which articulates with the sacrum, right? And then this part is the body of the ilium and forms a part of the sacropelvic surface. So, on the iliac tuberosity, there is the attachment of various ligaments. So here we have the Iliolumbar ligament. Now the Iliolumbar ligament, obviously, it's obvious from its name that it is connecting the ilium to the lumbar vertebrae. And then posterior to that, we have the dorsal sacroiliac ligament. So we have three sacroiliac ligaments. We have a dorsal sacroiliac ligament, ventral sacroiliac ligament, and an interosseous sacroiliac ligament. So posterior to the iliolumbar ligament, we would have the dorsal sacroiliac ligament. And then here we have the interosseous sacroiliac ligament. So inferior to both the iliolumbar and the dorsal sacroiliac ligament, here we have the interosseous sacroiliac ligament, and then attached here is the ventral sacroiliac ligament. And then on this pelvic surface here, on the pubis, on the ischium, as well as on part of the ilium, is the attachment of a muscle known as the obturator internus muscle. So this obturator foramen is covered by a membrane known as the obturator membrane. So the obturator internus muscle actually covers the margins of the obturator foramen and then the whole of the membrane as well, and it is attached all the way over here. So in this view here, you can see this here, so it's a posterior view. Here you can see the obturator foramen, and then the margins of it are showing the attachment of the obturator internus muscle. Now moving on to the pubis, here is the pubic tubercle. Now on the pubic tubercle is attached the medial end of the inguinal ligament, right? And here on the anterior surface of the body of the pubis is the adductor longus muscle. Then on the conjoint, or rather the combined ischiopubic ramus, we have the gracilis muscle. So it extends from the body towards the ischiopubic ramus, the gracilis muscle, and lateral to the gracilis you have the adductor brevis. Now again, this is the origin of a muscle known as the adductor magnus muscle, and this extends from the ischium to the ischiopubic ramus. Here you can see the obturator foramen, the external side, the outer side of the obturator foramen, and along its margin is the attachment of the obturator externus muscle. And right here, lateral to the pubic tubercle, on the pectineus line, you can see the pectineus muscle, right? On the pectineal line, you can see the pectineus muscle. So going back to the original two views of the hip bone, this is the outer view or the lateral view, and this is the medial view. So here, this is the pubis, and on the pubic tubercle, we have the medial end of the inguinal ligament. On the anterior surface of the body of the pubis, we have the adductor longus muscle, and then here you will have the gracilis muscle, and just slightly lateral to the gracilis, you will have the adductor brevis muscle, and then extending from the ischium to the ischiopubic ramus, you have the adductor magnus muscle around here. Okay, and then all around this obturator foramen would be the obturator externus muscle. Moving on to this view here, we will have again, this is the pubic tubercle. So the inguinal ligament will extend from the anterior superior iliac spine here all the way to the pubic tubercle here. And this here shows the internal view of the obturator foramen. So here we will have the attachment of the obturator internus muscle. So this blue part here represents the ischium. This is the greater sciatic notch, this is the ischial spine, and this is the lesser sciatic notch. Now here we have two muscles known as the gemelli, right? So you have a superior gemellus and you have an inferior gemellus. Here is the attachment of the superior gemellus, and then here you will have the attachment of the inferior gemellus. You'll obviously learn all of this in more detail when you do each individual muscle. So we talked about the ischial tuberosity yesterday and how horizontal ridge divides it into an upper and a lower part, and then the upper segment is then divided by an oblique ridge into a supralateral and an inframedial part, and then again the lower part is divided by a vertical ridge into an outer and an inner part. Now various muscles are attached on these parts. Starting with the supralateral part, there is the attachment of a muscle known as the semimembranosus muscle. Now the semimembranosus muscle forms a part of a group of muscles known as the hamstrings. The hamstrings is a group of muscles in the posterior compartment of the thigh, and these muscles are responsible for bringing about extension at the hip joint and flexion at the knee joint, right? So this here is the semimembranosus, which is a hamstring muscle. In the inframedial part, you have semitendinosus and long head of biceps femoris muscle. Both of these muscles are also hamstring muscles. So the inframedial part has the semitendinosus and the long head of the biceps femoris. Now after that, this lower part is further divided by a vertical ridge into an outer or a lateral and an inner or a medial part. The outer part here is the origin of the adductor Magnus muscle. Now this is the ischial origin of the adductor Magnus muscle, right? And this part right here, there's no muscle attachment here. This is covered by fibrofatty tissue as well as a bursa.